Imagine this. You're coming onto shift, taking all 12 of your patient vitals when bam, your electronic blood pressure cuff stops working. After searching for a new one, you find that all there is available are the supplies to manually check their blood pressure. But the dilemma is, you don't know how to do it manually. Well, fret no further. My name is Kaviana Shelton, and today I will be demonstrating how to manually check someone's blood pressure. There are many reasons as to why it is important to regularly check your blood pressure. A few of them being so that you have a clearer picture of your risk for heart disease and stroke. Normal pressure is important for the proper flow of blood from the heart to the body's organs and tissues. To begin, you will prepare your equipment and ensure you have the proper supplies. You should have the stethoscope here, the blood pressure cuff, which is this, and the sphygmomanometer, also known as the gauge or valve. This here is the pump. The stethoscope is used to listen for the heartbeat. The cuff is used to monitor the heartbeat around the arm, and the gauge is used to track the heartbeat as the needle moves up and down. Next, you will prep your patient. Ensure that your patient is calm and relaxed. If they are not, it may affect the reading of their heartbeat. Ask them if they have eaten or smoked recently, and if so, it is highly recommended that you wait at least 30 minutes before checking their blood pressure. Have your patient seated, legs uncrossed, arms and palms face up. Oftentimes, patients prefer to have their blood pressure taken from a certain arm. At this time, you will ask your patient, do you have a preference of which arm you'd like me to check your blood pressure on? You will then proceed with checking for the patient's brachial artery. You can do this easily by pressing 2 fingers on the crease of their elbow. Don't be afraid to press a little firmer if you're having trouble reading, listening, or feeling for their pulse. Once you find the pulse, you will start by sliding the blood pressure cuff up their arm. There should be arrows on the cuff indicating where the vein is located. Tighten the cuff enough to where you can easily slide 2 fingers in between the cuff and your patient's skin. If it is too loose or too tight against your fingers, adjust accordingly. Have you roll your sleeve up. Here is the arrow indicating where the artery should be. The brachial artery should be right here. Your 2 fingers should easily slide in between the cuff and against your patient's skin. If it is too loose or too tight, adjust accordingly. This is too loose, so I will tighten it just a little bit. Have her rest her arm here. You will take the valve or the gauge and clip it to the cuff. And let it hang. You will then grab your stethoscope, place it on both ears, and check to make sure that you can hear a tap on the diaphragm. I'm going to tap, and I hear the thud. Place the diaphragm directly on top of the brachial artery underneath the cuff. Make sure the needle on the gauge is at 0. Grab your valve and turn the dial to tighten it. To help me remember which way inflates and deflates the cuff, I go by the common saying, righty-tighty, lefty-loosey. Once the valve is tightened, start pumping. General rule of thumb is to pump until you see the needle hit 180 to 200 millimeters of mercury. That is where you'll look here and watch the needle go up to 180 or to 200. I'm going to slide the diaphragm up her arm, press it right against to where I felt her brachial artery pulsating. Going to make sure that the valve is at 0, and I'm going to tighten it. This is the dial here. Tighten it to the right to tighten it, and I will start pumping it. As I am pumping it, the needle on the gauge will go up. I'm going to go in between 180 and 200. As you are pumping, once the needle lands on the desired number, turn your dial to the left to let the air out. Make sure to go slowly as you're releasing the air. You should be focused on two very important things. Pay attention to how slowly you are letting the air out. This is important because if the air is released too fast, it could disrupt the reading. You should also be focused on the first do-do that you hear. Once you hear the first do-do, record the number to where the needle was when you first heard it. This will be your systolic number, also known as your top number. Once you hear that first do-do, do not stop letting the air out. Continue to let the air out, but go very slowly as the air is releasing. You will hear the heartbeat multiple times. When you hear the very last heartbeat, record that because that will be your diastolic number, or more commonly known as your bottom number. Typically, patients like to know their reading. This is where you will tell them your blood pressure is. They may or may not ask for more information about their blood pressure. So, I'm going to go ahead and put this on. I am listening for her brachial artery one more time to make sure my diaphragm is in the correct spot. Okay, so tighten it to the right. Hold the diaphragm against her skin and start pumping. As you are pumping, this cuff will get very tight. If it is too tight for your patient, it is okay to loosen it. I'm going to slowly let the air out. Okay. This patient's blood pressure is 130 over 86. That blood pressure is within normal range. I'm going to go ahead and take everything off of the patient and ensure that they are still doing okay. Are you okay?
I am.
Remember when that electronic blood pressure machine stopped working? Well, now you don't even need it anymore because you know how to manually check someone's blood pressure.